of course, there are still some differences in different countries and different guidelines. However, everyone now agrees on the fact that at baseline, so prior to the start of the first treatment or also later lines of treatment, the minimum requirement nowadays is whole body low-dose CT that completely substituted the whole body X-ray that is now considered a suboptimal technique. And when it's possible, in particular when you would like to use imaging technique to check the response after therapy, you may also use PET-CT or MRI, but the minimal requirement is low-dose CT. At the same time, as I said, we know that we need nowadays to look at the response also outside the bone marrow, so using imaging techniques. And in this context, the preferred imaging technique is PET-CT because it's the one for which there are the strongest data and more reliable and reproducible. However, functional MRI techniques like diffusion weight or contrast enhanced MRI are approaching. So there is some experience, in particular in some countries. The process of standardization is ongoing, and so I think that in some years from now also this technique will be of help. So there has been quite a lot of job that has been done on the standardization of the techniques. So we have nowadays a recommendation for acquisition, interpretation and reporting of the 3 techniques. So low-dose CT, PET-CT is ongoing and MRI as well. So this recommendation can be used in routine clinical practice. Of course, these techniques remain quite expensive, so it's not always possible to perform all of them. And as I said at the beginning, different countries do have different guidelines and reimbursement. However, we do have nowadays recommendation paper by the International Myeloma Working Group that was published some months ago that can be the basis for the use of these techniques.